Audio Jungle. Audio Jungle. Audio Jungle.
Thank you very much for joining us. You're watching another edition of the MedFiles program, the one medical program that brings you questions from you and brings you doctors and medical experts to answer those questions. I am your host, Marianne Waisha, and I will be hosting in studio Dr. Paul Wanjohi of Sky Medical Services. Dr. Wanjohi, we are glad to have you in studio.
Thank you.
Today we'll be dealing with back pain, we'll be dealing with a few questions from an elderly man, but
Okay.
we'll delve into them as we take them.
All right.
All right.
Mimi ikawa ni mimi ni mtu wa sukari na blood pressure na ninaenda kwa hospitali mara nyingi na nampa tabu yangu ya mguu. Sasa sijui kwa nini mguu inauma na nikienda mara nyingine na nikienda kidogo alafu nipumzike kidogo kama dakika 10 inapoa. Sasa huu mgonjwa sijui namna gani ingekwisha namna gani, lakini kama fana kwenda fana sikio uchungu na naambia daktari na hapa hawaja jania pia dawa yake.
Okay, this is an elderly man who walks with a walking stick, walks with a bit of strain, actually quite a bit of strain. And he says, well, he walks around quite a bit, but he's not able to do a long distance. He walks for a few minutes, then he has to sit, he has to sort of take a breath,
Yes.
Relax a bit,
Yeah.
and then continue walking.
Yes.
But even when he walks, he still has to use a walking stick, and he
Okay.
has a bit of a limp.
All right.
So the question is, clearly this is an age-related issue because he said it came up just a few years ago. But what is it that happens with age that necessitates the walking stick and causes all that discomfort?
Yes. Yeah, you're right that this is an age-related issue. And as we grow older, there are certain changes which happen in our joints. And these changes eventually result in something which we call the osteoarthritis. So osteoarthritis, which is also called degenerative joint disease, is mainly a disease which happens as you grow older. The older you are, the more likely you are to get osteoarthritis, and the higher the likelihood that the degree of arthritis is actually more progressed than in somebody who is of a younger age. Yeah. Now, as we grow older, usually, if you look at the joints, our joints, if you look at your joint structure, our joint structure have a number of things. Yeah. Usually you have your bones, and then you have cartilage, and in between the cartilage you have a certain fluid, and this fluid is a lubricating fluid, so that as the bones, the joint, they don't rub on together, and they don't. You don't result in destruction of the cartilage in that process. Now, as you grow older, your body's ability to regenerate cartilage reduces.
So cartilage regenerates.
It regenerates, yeah. It regenerates. As you do your normal activities and you strain your joints, sometimes here and there, you might actually damage a bit of cartilage, but your body has a system of creating new cartilage. Now that process slows down once you become older, and it can slow down to such an extent that your normal activities can increase the destruction of cartilage, such that the cartilage is being destroyed faster than it's being regenerated. Now, when you destroy cartilage, you have certain changes in the joints, and those joints are the ones which contribute to osteoarthritis. One is pain. The commonest is pain. You have a lot of pain.
This is pain that comes as a result of
the rubbing
this,
of the destroyed
friction.
cartilage surfaces. Yeah. Now, that is one of the symptoms. And because of that repeated rubbing, that place becomes inflamed and you have swelling, you have fluid accumulation, and eventually if you destroy the cartilage so much, eventually the process can go to the underlying bone, because underlying the cartilage is actually bone. So it might reach us.
The cartilage is eaten away completely.
Yes.
You get to the bone.
And once you get to the bone, then the process becomes much worse.
Yes.
It becomes, I mean,
Imagine that's
yeah,
very painful.
that's really significantly painful. So this is something which you see in the elderly. And a number of joints can get involved, but the commonest joints are the joints which are used a lot. Mainly the weight-bearing joints. You find that these are people who will complain about knee joints. They'll complain about their ankle joints. They'll also complain about their hip joints.
I see.
Okay. Now, those are very common joints because those are weight-bearing joints. There are also very many bones which constitute your spine, your spinal column, and that is also an area which gets involved a lot in the arthritic process. So as somebody becomes older, the same arthritic process goes on in your back, and that's why you find that older people have a lot of back issues.
Yeah.
They complain of back pain. A lot of that back pain is an arthritic process which is going on in the back. So it's something which happens in the elderly. It can happen in younger people, but it's not as common. If you injure a joint, you can have osteoarthritic changes in the joint later. Like if somebody fractures a bone and that fracture involves the joint, the joint lies in the line of the fracture.
Yeah.
If it's not repaired properly, a number of years later, and which can be a number of years, maybe like 2-3 years, the person might start developing osteoarthritis in that joint. And later, you find that this is a young person and they're actually having arthritis of the knee joint.
I've heard of sports people who got injured many years ago, and then you find it is now that they're starting to feel pain in the joint, yet it healed many years ago.
Yes.
In elderly people, there's, I don't know that it's connected to what you're talking about. There's also the stoop that you find.
Yes.
I don't know whether that comes from now the continued use of this cane stick that they usually use, because they usually bent over. How does a stoop come about?
Yeah, usually that happens because of a number of things. A number of things happen in the spinal column. The main one is the arthritic process. The arthritic process involves the spinal column in such a way that you can even have collapse of some bones. Some spinal bones might actually collapse. Yeah, and when it collapses, then the spinal
person gets shorter.
Yeah, the person can get shorter, and the curvature of the spine can change. And also, with the arthritic process, sometimes the discs, because between the bones you have discs. The discs can actually move, and that movement of the disc usually creates a curvature which is a forward curvature. So you find that the spine, somebody
sort of bends
in front. Yes.
So the collapse of the bones that you're talking about, is that painful, or is it just a slow process that happens with aging and one would not feel? Most
of the time is actually significantly painful, because by the time your bones are collapsing, you already are suffering from arthritis.
Yes,
you're already suffering from something called osteoporosis, which is your bones, they don't have enough calcium support, so it's easy for them to so all these things are already happening, and you're already manifesting symptoms. By the time somebody gets collapse of the bone, you might even have the surrounding nerves and other tissues being compressed by those changes, and that compression of surrounding nerves and other tissues causes symptoms, pain being a significant symptom
of them.
Yes.
So this is something that we are saying happens in old age.
Yes.
I mean, for those of us who are not there yet, you and I and so many others, what can we do now, perhaps that could delay this kind of age processes?
Yes. As you have said, we can delay the process, but
can't totally avoid
we
it.
might not be able to say that we can avoid the process right now. So we can delay the process. And how do you delay the process? The main thing is back care. How do you take care of your back? Because a lot of the things that you do right now in terms of back care, you're going to get payments many years from now. So back care is very important. By back care is, how do you lift, for instance? You know, you're supposed to lift with a straight back, you're supposed to lift with your thighs and a straight back, you're supposed to sit upright, not stoop. Things which are relatively common sense. Most people nowadays will know about this, but in terms of practice, many times people don't do that. And because you can escape with some of those things right now, later things can happen. Yeah. So the main thing is back care, and also exercise. Exercise is good for the back. If you exercise, if you're a physically fit person, then your back is usually relatively stable. You find that people who are active, they exercise, they suffer less from back problems compared to people who are obese, very big, very sedentary. Yeah? So exercise is one of them. Also, general lifestyle issues like nutrition. Because as I've said, by the time you're having the bones are collapsing, there could be an element of even weakness of the bones which are there, because of calcium issues and so many other things. Yeah. Now, if you're eating well, then you can delay the process such that, the chances of that happening are reduced. Yes.
And perhaps that is why sometimes you would find as 80-year-old, two 80-year-old people, and one is agile and
the other one is having issues.
Immobile. All right, let's see the next one.
What I would like to know is what causes back pain in younger generations, because I thought back pain is for elderly people, but nowadays you find that somebody who is under 30 years is complaining of back pain. What actually causes it, and how can it be treated?
This is from a young person.
Yeah.
Very similar to what we discussed in the previous question. This is a young person talking about back pain, and his question is more of as far as he knows, back pain has always been associated with older people, just like we were talking about in the first question. But he says now there's so many people in their 20s who will suffer extreme back pain. Yet for him, this is something that only, his grandparents and great-grandparents were dealing with.
Yes.
For him, it is completely foreign to have to deal with, and he's in his 20s.
Yes.
So what is it that would make a young person have the same problems that somebody in much later years would be having? Yeah.
It's true now back pain is becoming more common, and one of the reasons why the young are getting back pain more commonly is there's been a change in lifestyle, and if you look at occupation wise, you find that the young people are the kind of occupations that they are doing, a lot of them involve issues to do with sitting a lot in the office. So we don't know. Some of them, it boils down still to back care, because it depends. How do you sit in the office? Do you exercise? Because you find that exercise is becoming an issue, and it's not just back pain. There are also other things: hypertension, diabetes, cancer, and all those other things. Lifestyle changes. Back pain is one of them, because you're not exercising. As we have mentioned, exercise is good for the back. You see, nutrition is good for the back. All these things have changed. Now, a very, very significant cause of back pain is stress.
Really?
Very, very significant. And it causes something called functional back pain, where somebody has back pain, but you do investigations, you do imaging studies, and everything is normal. Nothing. But they are having back pains. That is called functional back pain. It's a bit of a tension kind of pain, in the way somebody can get a tension headache, and even you touch your temples and you're feeling your muscles are aching. So sometimes they get that kind of thing. Now, stress levels in the young have massively and significantly increased over time.
Over the last few years. But let me take you back a bit.
Yeah.
As far as I understand, stress is it's psychological.
Yes.
You know,
Yeah.
how does that translate to back pain, and why the back? Why not my arm? I mean,
in some people, actually, it goes even beyond the back, and other places, other places hurt. But the back is one of the common places. There are certain conditions where it's not just the back which will hurt. You will have pains in the joints, and you will have so many other.
all because of
All because of stress. Because you see, the body is very, very responsive to the impulses that the mind gives it. Okay, that's why if somebody comes and gives you a piece of bad news,
you get a headache.
you get a headache. If I take your blood pressure, what happens to the blood pressure?
It will be high.
It's high. You see, so somebody just talking to you and you receiving a certain piece of information is affecting your body. That happens through the mind. So the mind has a lot of control over the body, and stress is one of those things. If you're stressed in the mind, the manifestations are in the body. If you look at stress, it's not just back pain, hypertension. If you look at ulcers, so many, there are so many conditions. They're even attributing certain cancers right now to stress. So stress affects your body. There's a definite relationship between stress, mental stress, and the health of your body. Yes. And with back pain, especially functional back pain in the young, it's a very, very significant percentage of people who just have this back pain. And they get treated for the back pain, but the problem might not even be that. Might actually be in the mind.
In the mind.
They're actually stressed and that kind of thing.
And in a situation like that, what medication would not work?
In a situation like that, medication would relieve the symptoms. You see, but you're not dealing with the root cause, because if somebody is having persistent stress issues, you give them medicines, of course.
Give them, say, some ointment to rub for the muscles.
They will feel better, but the stress is still there.
So the pain never really goes.
So the pain goes, it's like you're given a painkiller, but later, if the stress persists, the back pain might come back. You see? Yes.
Okay, so I think that's one key thing that young people should pick up on.
Yes.
Yeah, it doesn't have to be your grandfather or,
Yes, that's
or
true.
somebody like that.
Yeah.
Let's take the last one for today.
Why do I get a broad sight after reading the newspaper and watching television? That now I'm not able to visualize what I'm... I mean, the figure comes in a broad image. I get some bit of irritation. Yeah, maybe when I'm watching television, I try to go either some bit closer or... I don't think it's an optical problem, because after some bit of time it clears. At that particular point, what can I do? Should I use an eye cleaner or something like that? I fear going to these opticians, because the next thing they always tell you, you need to wear specs. I went to wear specs for 30 minutes.
This falls squarely in an ophthalmologist's on an ophthalmologist's desk, but I'm sure it's very general.
Okay.
You'll be able to address it as well. This is somebody who says they get blurred vision and a bit of pain in the eyes after watching TV and after reading a newspaper. And actually, it's that, you know, the discomfort and what he calls a bit of pain and that blurred vision doesn't last long. Like he'll switch on the TV, and for the first 10 minutes it will be blurry, and then after a while it clears, and the picture is clear. Same thing with the newspaper. Pick up a newspaper to read, and for the first few paragraphs it's blurry, and after a while you're able to read quite comfortably.
Yes.
What would you say causes that?
Somebody who is having intermittent blurred vision, especially when they have to read small print or they have to try and focus, that most of the time is something we call the refractive error. This is somebody who most likely has a refractive error. A refractive error means that this is somebody who has a defect which requires corrective lenses. He probably needs to wear glasses.
But how come it doesn't last? I mean,
Because
if I need
usually-
glasses then should be there.
No, what
throughout.
happens even with glasses, if you strain, you can be able to, your eye can be able to adapt with a bit of strain, and in the process, it's working a bit harder, but you are able to see. But it's not working in a relaxed manner. It's like if you give me a piece of weight to hold in my hand. Now I'm holding this weight. I'm able to hold it, but this muscle is not relaxed. It's actually working. So when somebody has an eye defect, especially relatively mild defects like mild short-sightedness, long-sightedness, or something called astigmatism, depending on the degree, the person might notice that if they strain a bit, they're actually able to see, but they start complaining of a number of things: intermittent blood vision, tearing of the eyes sometimes, redness, headache. You see, this is somebody who find they are able to see, but for the eye to see, it's working
A bit too hard.
A bit too hard. The eye is not seeing in a relaxed manner, so the eye is working. That's why they are getting all these things. Yeah. So when they relax the eye and they change focus, they get the blood vision, and then they have to focus again, and then everything becomes clear. Most of the time, it's a refractive error. Majority of the time, there are other things which can cause that. They're not as common as that, but there are also other things which can cause that. I mean, one of the things which can cause that is something called a dry eye syndrome. I mean, there are people who have dry eyes, and there are a number of things which can cause dry eyes. Yeah.
Meaning you have no tears.
Yeah, you either you don't have tears or you're not blinking enough. Yeah.
Okay.
It's been shown that people who work on the computer for long hours, they blink less than they're supposed to do. And that lack of blinking dries the eyes.
They blink less than the ordinary person,
Than
or
the
the
ordinary.
computer requires them to blink more.
No. Than the ordinary person. Yeah. So that tends to dry the eyes, and the eyes dry, then you get a bit of blood vision. So that's one of the things. There are certain medication which, if you are on those medications, then they can predispose
Side
to
effect.
blood vision. You can get a bit of blood vision, and some of these medications are common medicines that we use even over the counter. If you take cold medication like antihistamines, antimalarials, certain blood pressure medication, they can cause blood vision. Yeah. So for such a person, the recommendation, the first step would be for them to go and have their eyes checked. They see, is there a refractive error? Many times a set of glasses or contact lenses might sort that out. Yes.
So this is somebody who, as much as the problem sort of resolves itself after the 10
Yes.
minutes,
Yeah.
that should not be an indication that, you know, whatever the problem was, the eye has been able, or the body has been able to sort it out.
No, it's not an indication that that everything is fine. Yeah, it's an indication. It just tells you that the eye is able to see, but for it to do that, it has to work at a higher level than normal. So the visual
Needs to
system
be assisted.
is not relaxed. Yeah, things are. I mean, they are working a bit harder than normal, and many times they might eventually develop other symptoms. There is somebody who might start saying that sometimes I get this headache. I don't know where the headache comes from. Yeah, because when you strain your eyes will not pain. You'll actually get a headache.
Yeah.
You see, so they might actually start complaining of other small symptoms here and there and that kind of thing. You see, and this is somebody who even at night when they are driving or something, sometimes they might find it very difficult, because during the day fine they're able to do that, but put them at night where the light levels are pretty low, then they might have particular difficulty driving at night. So it becomes even a bit dangerous sometimes for the person themselves.
To drive.
Yeah.
And those, I've heard of people who have night driving glasses. The purpose of those is to reduce the light, the night light.
Yes, some people, that happens, that those ones are given to people who have glare issues, which is different from this.
From this,
What
we're talking about.
People who have glare issues, people who have certain conditions which predispose them to glare. And for those people, one of the things you want to do to them is you want to give them the
anti-glares, sort of like what we have on the computer screen.
Yeah, something like that, so that when they are driving, they're able to, it's not so bad. Yes.
It doesn't cause strain.
Yeah.
Well, that's all we have today. Thank you very much for coming in. We hope we can have you next time. We have lots of questions You have been watching the MedFiles program. I have been your host, Marianne Waisha, and we've been talking to Dr. Paul Wanjohi. Remember, you can send us your feedback regarding this program on the numbers 22330, that is 22330. Alternatively, you could send us an email using the address medfiles@threestones.tv. See you next time.
Audio Jungle. Audio Jungle.